I'm not here saying you should never apply potassium, okay? What I'm saying is you should apply potassium only when there's a good reason, whenever you see a deficiency or whenever your turf has looked a little off or whatever, and you confirm that with a soil test that indicates you're low. I would say we do have enough. I mean, I'm fairly confident with the potassium levels on Mehlich 3 tests. I can't really speak for potassium on some other tests, but if you're using Mehlich 3 tests, I'm confident enough with the potassium numbers on Mehlich 3 to give you an idea of what your risk is. So, I mean, if you're 40 or 50, you're on the line, basically. If you're below it, it doesn't mean that you're going to have bad turf. But certainly if you're down in, the teens or the 10, 20 range, then you're at a pretty high risk of potassium deficiency. So the reason I'm saying that is I could make a case to recommend the application of potassium without looking at the turf grass, possibly. I wouldn't be real comfortable with that, but it's possible. You could at least express to the client or to the manager, hey, I would keep an eye on this because you're getting down to the point where it's very likely that you're going to experience potassium deficiency at some point. Okay. So I guess, that's my take on potassium and soil testing. If you're above 50, 60, it's really parts per million, Mehlich 3, it's really hard for me to be convinced that you're going to see a positive response to applying potassium. I just have never seen that in the literature. Around the 50 mark is where the line is. I'm sure someone can pull it up, but I've just never really seen any beneficial response to applying potassium in the literature when you get above 50. There might be one or two odd papers, but I just don't have really any good reason to, unless I'm looking at the turf and I can see that there's a potassium deficiency, I can diagnose that, and your potassium is like right at 50, then that would be a good reason to apply it. But once you're at 50, 60, I just don't see any point. And in fact, you can see here on this yield here that the yield went down from applying potassium in this case. And we showed paper after paper where not the yield, but the disease went up from applying potassium on turf grasses, both warm season and cool season grasses. You greatly increase the chance of disease incidence, not reducing disease, increasing disease. This whole idea that potassium is going to reduce your stress and reduce your disease incident or whatever is only the case when your potassium is well deficient. Once it's sufficient, applying more potassium is only going to increase your disease risk. So I'd be careful with that.